Okay, this is the ankle fusion implant removal, broken nail Jaslok. Now, this is how the patient had come to me earlier, and ankle fusion was tried to do. Couldn't fuse the ankle, so this is how he was operated upon. And 8 years he went through. 8 years he went through, and he started developing a pain. There is this nail is broken down after 8 years. So he went to a local doctor who could remove this broken part of a nail. And the patient became so psychologically disturbed that he wanted to remove this part also. When he came, I explained to him that it doesn't need to be removed. You can be without any problem, but he wanted to remove. So hum bhi gada jaisa, I also started taking it out. And there my saga started. So now I went through the point of entry of the nail in the line of the tibia. So I put in the things and I started making I reamed it all the way up, as you can see.
Yes, sir.
And then I put in this extractor. Shiva ka jo ye banaya na Shiva na extractor.
Yes,
I put in the extractor. So I jammed the extractor. So I was very happy. Now I went to remove the screw. So ये screw निकालने को गया, screw came in my hand. This screw came in my hand now. So now to go, the screw came in my hand, screw bit. So I started off with this AO device, taking it out to remove this broken screw. I didn't succeed. I could see it there, but I didn't succeed. So now again second saga started. I had to ream it here with the hollow meal. I reamed it, and also I had to ream it from the hollow meal on the other side. So two sides I had a hollow meal. I called it out, and once the hollow meal was removed, same done on the opposite side. And then this screw, ultimately this screw came out. Now what happened is this screw came out, and I realized that the extractor which I had passed here, it had broken down. So since that extractor could not work because it broke down. So I tried with the hooks. As you can see, this my hook wire is going up. I tried to go to the hook wire. I couldn't go. So I went proximally. I went there, started pushing it out from proximally. And once I started pushing it out from proximally, it started coming out, and the whole thing has come out. So I think I had to go through all this cycle, basically, to remove this implant purely for the psychological reason of the patient. Fortunately, everything has come out, and there is no problem. Now here is a Shiva's case. Shiva, can you start over?
Yes, sir. Next slide. This is a young boy who sustained fracture of the femur, and I operated him in 2010, and he came in 2014 for implant removal. Next slide, sir. These are the X-rays he had brought. I have got better X-rays. Next slide. Which I had taken the digital pictures. These are from my collection. The earlier one was the patient who had brought the spoiled X-rays. So after 2010, patient had never come for follow-up. That indicates that the beauty of this fixation, that the patient was totally pain-free. Next slide. So this is at 4 years follow-up. He came for implant removal. I didn't suspect anything, and I admitted him for implant removal. Yeah, next. These are the clinical pictures when he had come for implant removal, full function. Next slide, sir. I applied the extractor as usual from the top. I normally, before removing any of the screws, I apply the extractor bolt from the top. When I applied the extractor bolt, it was started wobbling. That's why I took the C-arm and I confirm. Next slide, sir. only the part of the nail came out. Next. And retrospectively, now seeing there was a crack. This is what I didn't realize pre-operatively, but post-operatively I have taken a zoom picture. That's why now I am able to show that it was broken, which was totally missed by me. Next. Now, to remove the extractor, I have designed the broken nail extractor, which is nothing but a reverse cut extractor. But the tips here is you should over ream the proximal fragment, because if the nail is 10 millimeter, at least you have to ream the proximal end up to 13 millimeter, 12 millimeter, so that the nail will not get stuck. Many a time at the broken area of the nail, there will be new bone formation, and your extractor, even though it has got a good purchase, when you try to extract, it is lodged. Yeah, next. I am reaming with a straight puncture reamer. Next.
Shiva, can there be an issue of trajectory of the broken nail part and the trajectory of your whatever you removed,
Yes,
reamed it?
that's correct. In some time, if the fracture has not united, if the fracture goes into varus or something, then the trajectory is problematic. Even in such cases, over reaming will take care of that and it can straighten it. Now I am applying the broken nail extractor. Here also, what I normally do is I just take out the distal locking will be there. I take out the distal locking and put a thin Steinmann pin. Normally, distal locking is 4.9 millimeter, and I put a 3 millimeter pin and I hammer the nail down first so that it gets dislodged. Next, this is the extractor which is being applied in the reverse thread fashion. Next, next. Gradually, you can see that by pressure of your hand between two index finger and thumb, that's all. You have to keep rotating just with the index finger and thumb. Try to extract it, it gradually comes out. Yes. Next slide. So these are the after extraction, this is the nail, and this is how the extractor gets fixed to the nail, and this is the after the removal of the. Yes. Okay, sir.
Now,
Thank
these two cases, if you like to discuss, we can discuss these two cases before we go further.
Then you will have to go back, sir, to get the slides on.
Not
Sure.
necessarily. Yeah.
Any questions on these two cases? Anybody? Yes,
I've got
Manoj Gupkar.
It is Dr. Prashun, I think, is speaking, or Devendra, who is speaking?
Sir, I'm Dr. Prasoon, sir.
Ah.
So, Shiva,
Bolo,
sir,
bolo.
I got a very funny question, sir.
Yes.
Once I use, sir, that your device, sir, this conical device for removal of the broken nail, sir.
Yes.
So I succeeded, sir.
Yes.
The problem was that you remove, and once this conical bolt gets so much fixed with the broken nail,
Yes.
to extract it out and to
Yes.
disengage it out is equally difficult, sir.
That's a good thing then.
So it is a one-time use only.
No, it's not one time use. The threads get spoiled after 5-6 extraction. So that's why I gave the tip, you should over ream it, and you should dislodge the distal fragment from the medullary canal by pushing the tail slightly about few millimeters down. Then only you should apply the extractor so that the life of the extractor increases.
Shiva, my experience is how many times you can use it, because Tanna sir has shown that his tip was broken because it's a hardened material.
No,
it is a hardened material.
That problem was there earlier. Earlier, what we were manufacturing, I have tested so many materials. At least I have done about 10 different varieties of material and have tested. And when the carbon content was breaking, and now it's pure steel only. Just we harden the tip. Now that problem is totally solved. Only thing is the problem is nowadays is the threads gets spoiled after few extractions. So on an average, we can extract about 5 cases from one extractor, not more than that. Yeah.
Now the question.
We go
Now
to-
okay, go ahead.
Yes.
Then I will ask the question.
Yeah, any question? Please carry
A
on.
lot of companies now, all the companies they are coming with the similar extractor, sir, with different price brand
Yeah.
band. So is there
Yes.
any difference with the material, sir? Because somebody is selling in a very too high price, somebody is lower price. So every company is now having. So any difference in the material, sir? And
Yes, I don't want to promote a company, but definitely we have seen that all extractors doesn't work the same way. Yeah, the original is always original.
Yes.
Shiva, sir.
Whose case is this? I couldn't make it out.
And then, sir, there is a one question. There is a one question from the audience
Bolo.
that, sir, what we don't have broken nail extractor, what to do?
You
There
can
are
put it on the
Because
nail.
all of the surgeons may not have them available at the time of the unexpected broken nail.
No,
I think-
you should have. If you are dealing with a, this is not an emergency.
So that is the message.
Yeah,
Shiva, sir.
yeah.
Okay,
Yes,
now-
Rajendra.
Dr. Monappa sir is want to ask something, I think.
Very, very basic question to Shiva sir. You extracted the nail in a lateral position or
Yeah,
in a,
normally I do the lateral position only, removal. Yeah,
all nails we do in a lateral position? Okay, right.
yeah.
Whose
Naveen Raj,
case is this? There was no name. Whose case is this?
Good evening, sir. I'm Dr. Devendra from Coimbatore. It's
Bolo,
me.
beta.
Yes, sir. This is a 45 years old gentleman presented to us with pain in the thigh after an interlock nail performed about 3 years ago. And he had, on examination, he was found to have a non-union of the femur. And there is a broken nail at the distal locking site, the second one from down. So we have posted for plan for removal of the nail and nailing and bone grafting for the non-union surgery. Next slide, sir. Both the screws were broken, and from lateral side, both the broken bits were removed. And
Can you tell me what screw is this?
sir, that is the introd. There was an intraocular fracture. It was operated
Oh,
elsewhere.
which you had fixed it up. Okay.
Yes, sir. They have fixed it with a cancellous screw for the intraocular fracture, and that has healed well. And patient has got a good range of movements as well. And once we started, we removed both the broken bits, and both the broken bits were projecting into the middle side, and they were away from the intramedullary canal. So I felt that there was any problem while dreaming and doing the surgery. Next slide. Initially, the proximal fragment was removed through the proximal femoral entry. There was no problem in removing the proximal fragment. And the distal fragment, as usual, we tried with two guide wires by passing through the canal, but since the canal was very narrow, I couldn't negotiate any guide wires across the broken bit, and I tried
Devendra, can you apply the earphone so your voice is cutting somewhat? Do you have a earphone with the mic or not? With the computer audio itself?
Computer audio, sir.
Computer mic. Okay, come nearer, little.
Yes, sir.
Okay.
Now, sir.
Yeah, settle. Please go ahead.
Yeah, yes, sir. Now, to remove the distal fragment, distal broken tip, I tried initially the two guide wire technique. Next slide, sir. I tried to pass two guide wires so that I can engage and I tried to extract it through the fracture site, but I couldn't negotiate because the canal was very narrow. Then next. And I tried as to using the reverse jamming technique also with the threaded conical tip. That one also couldn't engage. I couldn't engage. So at this stage, since it is a non-union and definitely we need to do intramedullary nail and bone grafting. And since I failed with all other techniques, I tried for more than...
Devendra, temporarily I am stopping your video. I am stopping your video so that we can get a good audio.
Now
Go
here,
ahead. Go ahead.
here, unless you remove this wire, how can you take out the nail? So you probably couldn't take it out because this screw was inside the nail.
Yes, sir. Actually, both the guide wires couldn't negotiate across the broken bit, and the conical tip also couldn't engage it, since the canal of the broken bit was.
No. See. What I feel is here is the track of the screw.
Yes, sir.
So if you take the nail up to here,
Yes,
you
sir.
will be able to go to the screw. You will be able to grow here, and you will be able to push out this screw out. This is how it is done normally.
Yes,
So,
sir. Yes.
What
Because
the
now you-
Devendra, what the sir is saying that there is a resistance by this broken screw. Some of the part is still in the hole.
Yes, sir. I retained that this one only to make sure that it doesn't rotate. It doesn't rotate while applying the conical tip. I just retained.
okay.
I thought
Okay.
once it's engaged. I thought I'll use a steel pin and hit the broken screw little bit onto the medial side and kept it as a derotation
Proceed.
purpose as well.
Yeah. Proceed.
At this stage, I thought since the anti-grade methods are not successful at this stage, I thought of going from through the knee joint by making a retrograde entry and then tap it up to the fracture site, and then through the fracture site, I took it out from through the non-union site. This is the picture where I made an entry in the intercondylar notch, like how we take the entry point for the retrograde nail. And then at that stage, I pushed the broken bit which was there inside the medullary canal of the broken bit. The broken distal screw was pushed medially, and then this was pushed up to the non-union site, and then through the non-union site, it was extracted out. And this is after this, this is the picture after removal of the broken bit. And next slide, sir. And this we performed intramedullary nailing and bone grafting for the non-union. So the take-home message is there are multiple techniques that is described to remove this broken bit inside the medullary canal. One is we can pass multiple guide wires into the canal if the canal is wide. Otherwise, we can use this reverse jamming technique by threaded conical tip. Or if not possible, we can go on to the other side, that is retrograde tapping of the broken tip also can be done. And before removal of the broken bit, we need to remove the screws. That can be done by using a Steinman pin and hit it onto the medial side, and we can remove the broken bit on the other side also.